that I've mentioned. We are really, really thankful for what they've done. As I said, this award actually is for a lot of other people and organisations, and not just the housing unit, but really thankful too that the Christchurch City Council administrators and governance are behind this as well. And I'm going to hand over to David Brinson, who's going to give you a project evaluation of what's gone on.
I'm just going to outline a little bit about evaluation, but just firstly acknowledging my colleague Sarah. We've been working equally on this project for a few months and co-authoring the evaluation report, which should be out soon. Our evaluation, we have conducted online interviews, online questionnaires, in-depth face-to-face interviews with managers, tenancy advisors and tenants. It was thick end of 20 hours of transcribing 20 hours of interviews and other quantitative data. But I've only got 4 slides and 2 stats, so as an evaluator, I think that's pretty lean. Just talking about a little bit about the purpose of evaluation, and as I flick through my 4 slides, I just invite you to think about merit, worth and importance in perhaps all the projects that you're involved in, and why we evaluate. And it's for the purpose of learning and development, certainly mainly those 2 in this case, and some accountability. But we'd like to be able to demonstrate that actually it's not too hard, and we'd be able to work alongside. I guess evaluation's more of a working alongside process. We don't stand back and just give a judgment at the end. We help develop as we move along. So at the end, I'm going to invite you to make the judgment with me on what you think is the merit, worth and importance of the project. So 2 stats. Here's the bad news. That graph, Lucy's already talked to us about equity, in this case inequity. The orange line is roughly the smoking prevalence in New Zealand over the last 10 years odd. The blue line is actually another study in a Housing New Zealand population, some thousands of tenants. It wasn't a smoke-free study, but they did robustly record smoking status. So you can see across that period there's about a percentage point difference in the prevalence. And our little red dot there is our survey data for the council tenants. And you can see that this approximately 10-point difference is persisting. So I guess our point here is that without intentional focused effort, it's unlikely that gap, that inequity will close by itself. But with focused programs like this, we hope that it will. That's the bad news, well, kind of both. The good news. A few people have asked questions about compliance already, and I guess one of the key points here is that for a soft policy, which this is, there's no really harsh penalties. It's a progressive rollout. It's not one point in time. So acceptance is a really key point. And what we've shown here is that, certainly for non-smokers, almost everybody, 90% thinks it's a good thing. In line with the international literature, the acceptance by smokers is not so high, but you can see there, if you add the numbers together, roughly 3/4 of smokers think it's at least okay. So, personally, as a non-biased evaluator, when I started the project, I thought, well, if it's bad, just ban it. That's kind of that's my baseline default. But really, it wasn't until we got into the evaluation and we considered the sensitivity of the population that Bob's described, that we sort of realised that, and tenancy advisors and tenants agree that the policy is about right. So getting that acceptance is very strongly related to the voluntary compliance that follows, and there's no heavy-handed approach, and getting that right, I think, as evaluators we see that as key to having the policy roll out over time. A little bit on partnership. Now, apologies to anybody who has been involved in the process who thinks this is an oversimplification. It probably is. And I know it's wider than this as well, but just as evaluators, we've just kind of tried to get a sense of how the partnership may have worked. And I've called it a non-linear process. So you might think of a partnership as an entity, but we're viewing it from an evaluation perspective as a process. So I guess the notable point there is what we'd call toing and froing. So things don't necessarily happen when you want them to, how you want them to, but with persistence and passion, things generally head in the right direction. And also acknowledging the wider context that nothing happens, by itself, and hard-won shifts in social norms facilitate projects like this. And finally, basically with reference to the partnership literature, we've kind of mapped how we saw the partnership against these criteria, and we found strong evidence of fulfilling all of these domains. And I've just highlighted a couple there, and I guess just talking about health and all policies again, it's probably one thing just to have a policy, but it takes extra effort and commitment to bring the health into all policies. So providing that cessation support, actually supporting sensitive populations to move through the process. And we commend the council for their passion and their interest in doing that. And that's part of the health and all policies approach, is to partner with non-health organisations and assist them to pursue their non-health objectives while bringing the health alongside.